Step into a world where secrets lurk in the shadows and danger is just a click away. In Shadows Behind the Screen by Dr. Nicholas Okumu, an innocent online adventure spirals into a heart-pounding fight for survival. Dr. Andrew, a respected surgeon, is thrust into a web of abduction and deceit as he fights to protect his family. A relentless police force hunts down a powerful cartel, always one step behind its cunning masterminds. Can he outmaneuver those who hold his life in their hands? Dive into the digital danger where survival is not guaranteed. Shadows Behind the Screen, available now. A good day, everyone. We have yet another exciting episode from Scrubs and Beyond, powered by StepCare. And today we have a guest, an amazing guest from East Africa, Kenya, in Nairobi, Dr. Nicholas Okumu. And we're going to be talking a bit about him. We have a podcast that is boiling, and we'll tell you more about that. Currently has published a book. We'll give you more context about that. So this is just a pre-warm-up session for a session that we're going to be having next week. Dr. Nicholas, how are you today, and how is East Africa?
I'm doing very well. I thank you for this opportunity to speak about a little bit about myself and the work I'm doing, and also share a bit about the book that I've written, which is a book with a cause, because some of the proceeds from the sale of the book are actually going towards the advocacy work I do. And I'm hoping that this is a good way to encourage people to give to a cause. I think the book is also interesting and exciting. So it's not money just going towards a cause, but also for some good reading content.
And I've read a bit of the book, but I don't want to spoil anyone. But I also just want to spark up your curiosity. You don't have to tell me the answer because I want to reach there by my own. But I personally think that whatever online calamity that Dr. Andrew is going through, it must be the wife. I don't want you to tell me. I don't want you to tell me, but I'll find out myself. I'm thinking maybe it's the wife. It could be the wife. But I don't want you to tell me anything.
I can confidently tell you it's not the wife. And so I'll let the readers also be surprised by who the actual villain is in the book.
Yeah, no, it's exciting. I can't wait to get them. So with the book and your profession, the demanding schedule, seeing patients, there are emergency surgeries there and there. Where did you find the time to get, or do you have 32 hours? Do you have maybe 4 more hours more than everyone in a day?
No, not really. I'll tell you that I've always I've been interested in writing, and maybe this was something that started right from when I was in school. I think my mother was an English literature teacher, so I was introduced to works by African authors quite early in life. So I've read probably every great African author on the continent, like the Chinua Achebes, Lechi Amadi, Wole Soyinka, and also inspirational books from other authors like Ben Carson, who wrote a book that inspired me to become a doctor. It's called Gifted Hands. I've read autobiographies about Nelson Mandela, Malcolm X, and so writing was something that was in me. But I always thought I didn't have the time. But earlier this year, I was attending a workshop in Rwanda for actually the project we're doing, which is called the Global Surgery Advocacy Fellowship. And one of the challenges we were given was about the things we've always said we'd like to do, but actually never get to doing. And so I thought about it and said, I've always wanted to write fiction, a story, to share a bit of myself. And I decided this year just to do that. And I think it's a good thing that I did it. And now it's really sparked an interest in me, and I think there'll be more books coming along the way.
Yeah, no, that's great. One thing I like about reading is that it opens a portal to, realities, to even knowledge that you thought didn't exist.
Yes.
People who are constant readers, they have knowledge privilege. And when you have knowledge privilege, you have the advantage. So can you just give us maybe a small breakdown of, we don't want to give the viewers too much and the listeners too much, just a little, you know, on what the book is about, where can we find the book, and how much is the book?
Okay. The book is about the internet and the online space, and things that we find are very easy to access these days, especially the aspects of online dating, and maybe the effects of that on our families and things like that. But also just to highlight that in all this fun and thrill that we're seeking, there's a hidden danger. And so that's what the book is about, the hidden dangers behind that we find in the online space, and what the consequences of that could become. And I thought this was one way of doing it in an entertaining way, just to tell a story that will make people think about it a little bit. I would say that way.
Yeah.
Once you get on, for example, an online dating platform, are we always at the back of our mind making sure that we are safe, that we are not getting ourselves into trouble that we cannot get out of?
Yeah. Yeah. And how much is the book? Where can we access it?
Book is available on Amazon. If you want the Kindle version, that costs about $10. And if you want actually a printed copy, they can do that for you for $16.99, which is roughly 17 US dollars. And that would be shipped to you. You can also access a copy of the book if you're in Kenya or in Africa from my website, drnicolasokumu.com. And I'm sure as we go forward, it will be available on other platforms as well.
Yeah, okay, no, that's amazing. So I want to know, you know, when you went through, is it Lenana School?
Yes.
Yes, and then you moved along to do your tertiary at something Salam. Could you please help me with the pronunciation? It's quite running away.
Okay, so I went to high school in Nairobi. You mentioned Lenana School, which is in Kenya is what's called a national school. So it's one of the top schools in the country, one of the oldest as well. And there you get to interact with people from all over East Africa, actually, which is a great experience. And then I actually did my A levels at Oshwell High School, which is mainly Asian school. So I think in Form 5 and 6, we were only 3 African students, which was also a very interesting experience. In Kenya, imagine you could go to a school where you're a minority, but it also opened my eyes to know that, you know, in whatever space you're in, people are just people. There you will find good people, you will find people who are interesting, you will of course find people who are a bit biased towards you, but that's life. There's no place where you'll go in the world where you'll find everybody who loves you. And so Oshwell was a great experience. And then I did my undergraduate medical degree at the University of Dar es Salaam, that's in Tanzania, which was a great 5 years. And an additional blessing is that I met my wife when I was in university there. And we've been married now for 17 years and we've been blessed with 2 children. And then I have done a master's degree in orthopedic surgery from the University of Nairobi. I also have an MBA from the University of South Wales. And now I'm pursuing, I've done so many things. I think I like learning. So I've done project management with the University of Cape Town. I started a property business, so I learned about property management and that also from UCT. And then this year, I've actually started a program at Harvard Medical School, which is all about leadership and leadership in the surgical space.
spectrum from primary school until tertiary. Was it determined that you're going to end up being an orthopedic surgeon, or is it something that you defaulted to? Because when we are just a little kid, when they ask, what do you want to be when you grow up? Everybody wants to be a doctor. Was it defaulted, or was it something that was like really built into your DNA?
My father died when I was a young man. I was in primary school. In Kenya, that I was in class what we call standard 6 at the time.
Yeah.
It's changed a bit over the years. And he was sick for a long time, about a year and some months. So that really sparked my curiosity because I think the doctors at that time were unable to figure out completely what was going on with him. And I watched my dad, you know, go from this vibrant guy to someone who was sick in hospital a lot. He eventually lost his eyesight and a lot of things happened along the way. And so my curiosity about medicine started there. When I got to medical school, surgery and it was a toss up between surgery and obstetrics, and becoming a gynecologist or becoming a general surgeon. I was actually the best student in surgery in my graduating year, but I also had an offer to come back and do a master's in obstetrics and gynecology, and I was actually going to do that. So what happened is that when you finish medical school, you go and do something called internship. And where I did my internship, my obstetrics rotation was a nightmare.
Yeah.
So it took me away from that and back to surgery. And as I joined the University of Nairobi to do my general surgery degree, we actually had the opportunity to choose orthopedic surgery because we were the first group that was able to do orthopedics at the University of Nairobi. So we jumped onto that, and that's how I'm an orthopedic surgeon today.
Wow, that's an interesting story. So let's talk a bit about your career highlights. So I'm gonna read the question directly. So you've had an impressive career spanning over to 20 years. That's like 2 decades and a couple of years. And what are some of the most rewarding moments you've experienced as an orthopedic surgeon from those career highlights?
I think my most rewarding time has always been my happiest time in any part of my life has been in the operating room, just having the opportunity to change one life at a time. Because with surgery, and especially orthopedics, you can actually see the results of your work almost immediately. Someone who walked into your office or hospital unable to walk, for example, and the next day you can actually give them back mobility and the ability to go back to their lives and work and be productive. I think that I would say is the number one best feeling in the world, to be able to actually transform a life in a way. So my happiest time is always when I'm in the operating room. But in let's say in the last probably 4 or 5 years, I've been also had the opportunity to be in a position of leadership, and especially as the head of Department of Orthopedics at Kenyatta National Hospital, which is the largest teaching and referral hospital in the region in East Africa. And as the head of Department of Orthopedics, I was able to transform our unit from a general orthopedic unit to what we call a subspecialty-based unit. So we created 8 new units, which include sports medicine, joint replacement, of pediatric orthopedics, hand surgery, and the one that I had currently, which is orthopedic oncology. And that actually allowed us to become what the vision of our hospital was, which is to be a world-class specialized hospital. And we are now doing surgeries that we we never used to do in the past. For example, in the last 1 year, we've been able to start doing limb salvage surgeries. This means that someone who has a tumor doesn't need an amputation. We can actually remove the cancer, but also preserve their limb function. For example, keep them walking. And that's a fantastic thing to be able to achieve. So I think to answer your question, my greatest achievement is always in every operating room when we come out with a successful surgery, but also the ability to have been able to transform a unit to something that is more effective and is able to do more specialized work. I think those would be my two greatest achievements. And then I would say this year I've started to do advocacy work because we've realized that a lot of the things that affect you in the operating room or in the hospital where you work are beyond your control. They're decisions that are being made by, for example, political leaders or policymakers or even members of the public without the understanding of what it is you are doing. And so advocacy is important. We need to tell people or let them know what the importance of our work is and how they fit in that work so that we can all collectively make the system better.
Wow, I'm interested in that global advocacy, but you also took me back to our previous conversation where you said that right now in Kenya, you have a situation whereby the government is investing in hospitals, but these hospitals are under-resourced. And you've also talked about how you improved some of the units, you talked about how you introduced sports medicine, the oncology, the orthopedic oncology, and some of the functions. So it only means that you need to be resourceful because there are, not much resources. So how do you navigate between that? I mean, building up a function where that the whole mandate of the country is let's make beautiful hospitals, but we don't have resources. So how did you overcome that challenge, to build those functions and to have them functioning perfectly?
It's something that is very important in the work you do. Whichever area you're focused on is your passion for the work. And so when we were building our specialized units, we actually gave our surgeons the opportunity to choose the areas that they were interested in. So for example, if someone was interested in sports medicine, we didn't tell them, no, you're going to be a pediatric orthopedic surgeon. We let them actually fall into the places where they thought they could do their best work. And when people are passionate about what they're doing, you'd be surprised at the kind of results they could achieve. I want to give as one example. There's an area of orthopedics called complex pelvic surgery. And when this kind of patients used to come to the hospital, they could spend even 3-4 months in the ward without having the surgery they need because nobody really wanted to do that work. But when we started a unit specifically focused on that and got 3 surgeons who were interested in that work, our waiting time for complex pelvic surgery went to 0. Like literally, they come today and they're operated next week because the surgeon who is doing the work enjoys that work. So I think to answer your question, the way to motivate people, to drive them to do more than they think they are capable of, is to find what they're passionate about.
Yeah, true. And as a global advocacy fellow, your main business activity is to commit to the improvement of safe surgical care and to also be, resourceful enough to say, okay, we are under-resourced here. What can we do? Can we use in knowledge and wisdom and experience what we lack in resources? And with that being said, let's zoom it up in Africa. What are some of the key challenges that we have in terms of, what I've just said, some of the key challenges that we have, and what are some of the ideas that you have that you think that these can be addressed? Maybe top 3 key challenges that are a burning issue now in Africa, and some of the ideas and concepts that you have in solving and addressing these matters.
Let's talk a little bit of numbers, and I hope I don't bore you with statistics. In the world today, we say that there are over 5 billion people who lack access to safe surgical, obstetric, and anesthesia care. If you come down to Africa, that number comes to about 1 billion. So 1/5 of the number of people who are lacking this safe surgical, obstetric, and anesthesia care live in Africa. That's close to 90% of the population. So it's not that they don't have surgical services. It's such that the surgical services they need at any particular time might not be available. So if someone comes to you with, for example, cancer, and you know he needs a certain type of surgery, but that surgery is not available at the time they need it. Or sometimes the issue is that they can't afford it. So I tell you, you need I want to use something close to me, which is the thing I mentioned earlier, which is limb salvage surgery. On average, to do a limb salvage surgery, you need about 10,000 US dollars. So you can try and look at across Africa and imagine how many of people will be able to afford that. And you will find a very few. Just give me a sec. I need to reconnect my charger. I hope that's okay.
All right. Okay, no, that's okay.
So, like I was saying, you can imagine how many people in Africa today would be able to afford $10,000, and that number is probably very few. So we need to find ways to be able, first of all, to make sure that the surgical services are available. And when they're available, how then do we mobilize resources in terms of money or funds to make sure that the people can actually afford it? And that ties into a big debate that's going around Africa. I think even in South Africa right now, you're talking about a national health insurance, and there's a debate around it. And in Kenya, it's the same thing, because the buzzword around the world is universal health coverage. How can we make healthcare affordable for the majority of the people? So there needs to be solutions around all those things to be able to make surgery accessible in a safe way. And so the discussion is about, yes, building hospitals. That's still important. We need those hospitals to then have the personnel, not just surgeons. Everybody is important. Even a nurse, a physiotherapist, a cleaner, someone in the admin department. These are all important to make a hospital work efficiently. And then we need to find a way, once these hospitals are built and staffed, to make sure that there are resources available to pay for the care, because the majority of our patients we see on the continent quite honestly cannot afford the expensive private healthcare. So when they come to the public sector, we need to be able to take care of them, but also make sure that we are not destroying them financially in the process.
Yeah, that's actually a good one. So free warm up. So let's not give the whole thing. Let's not give the whole thing. We have to leave them with a little bit of curiosity. So for the final leg of the conversation, I'd like to ask 2 questions. Number one is, what are the current projects that you are working on right now, that would bring value to the year 2025? And secondly, what should our audiences, my audience and your audience, expect next week in the official launch of your podcast?
I would say my number one priority this year is the advocacy work, because I've realized that we need to bring our voice to the table as healthcare professionals to make sure that we are not being our issues are being addressed. So, for example, we're working in Kenya today to change, number one, the policy that is all around cancer care, not just orthopedic cancer care, but all cancer care. Because number one, our referral system doesn't work. You can see a patient in a primary healthcare setting today, and before they get to the specialist, it will take 6 months. And that is just too long for a cancer patient. It means they're going to lose their life. So we need to change the referral policy so that patients can actually start from the primary setting and end up almost immediately with the specialized care they need. We need to do this in a sustainable way by generating funding. And that's one thing we're working on, to develop something called the Kenya Sarcoma Trust, which will raise money that can then be reinvested and the proceeds used to treat the patients who appear with musculoskeletal cancers. And I hope that this is something people can join in to get these funds together. We want to raise awareness about musculoskeletal cancers across the country so that people can be able to recognize the symptoms and seek care early. And then we want to train primary healthcare workers to be able to recognize those symptoms early enough and send the patients to the specialized facilities. So that's the basis of my advocacy work in the coming year. Something exciting which is tied to that is the role of artificial intelligence in healthcare. AI is the buzzword, and we think that it can transform healthcare. And I'm actually involved in 2 research projects that I think will greatly enable that. The first one is under an organization called Afrotech. And what we're doing is using a mobile phone, a 3D printer, AI and machine learning to be able to produce cheaper prosthetics. And we're doing this in a way that the patient never needs to step in a hospital to get their prosthetic. As long as they have a simple mobile phone with a camera and someone to take a video, they can actually send us that video. We can process it with AI and machine learning and use a 3D printer to produce the prosthetic and just ship it to them. So this will improve accessibility. It will make it a cheaper process. And it also works faster because the prosthetic can literally be produced within 24 hours. So that's really an exciting project that we are on. The other one that we're working on with AI is to help those same primary healthcare workers to screen for cancer. So we're developing an AI-based tool that works with X-ray and ultrasound to be able to screen patients and tell them, this thing that is growing in your leg looks suspicious. You need to go to see the specialist. And we're hoping that that will help us to receive these patients earlier. So those are some things we're working on with artificial intelligence that are really exciting. The last part is just to market the book. And like we said, 25% of the proceeds from the book will go towards this advocacy work. But I also hope that people will get to know me a little bit better and maybe share a little bit in my creativity and my dream and vision to make healthcare more accessible.
Thank you. Thank you. A wonderful submission. Yeah, that should conclude our conversation. Thank you so much, Dr. Nicholas, for availing yourself and providing value to our audience. I'm certain that what you are working on is going to flourish. Sometimes we look at these things and then they come in a form of a mustard seed, so we think they're small. But once we put them in the ground, take care of them, they just grow into this big tree that everybody will enjoy the shade. So you are up to something great, and I trust and believe that the world is going to benefit from that. So thank you so much for having, for coming to our podcast and sharing your value.
Thank you for your time also. I really appreciate this opportunity and the platform.
Thank you. Step into a world where secrets lurk in the shadows and danger is just a click away. In Shadows Behind the Screen by Dr. Nicholas Okumu, an innocent online adventure spirals into a heart-pounding fight for survival. Dr. Andrew, a respected surgeon, is thrust into a web of abduction and deceit as he fights to protect his family. A relentless police force hunts down a powerful cartel, always one step behind its cunning masterminds. Can he outmaneuver those who hold his life in their hands? Dive into the digital danger where survival is not guaranteed. Shadows Behind the Screen, available now.